So what I want to talk about in this video is panic disorder. And this one and the next video that I'm going to post are going to be the final videos on my patient education series. So basically what I was doing with these videos was discussing these topics in the same way I would with anyone that I say diagnosed on an inpatient unit, outpatient basis, or anywhere else with one of these disorders. So let's talk a little bit about panic disorder in general and get into some of the details. So with this first slide here, I just basically laid out a couple of scenarios, a couple of things that have actually been said to me in clinical practice, and examples of how people might describe having a panic attack. So the first one, it started for me 5 years ago. I was in a business meeting, and then out of nowhere, this crazy feeling came over me. I felt like I was going to die. I just couldn't explain it. The second one, for me, a panic attack is the worst experience of my life. I feel like I'm going crazy. I feel like my heart's racing. I can't catch my breath. And I feel like I have no control. The third scenario, even now that I haven't experienced an attack for several weeks, there's an underlying feeling like it could happen at any moment. It's really making me anxious. So for these people, each one of these scenarios kind of details an important point. The first one, the panic attacks tend to happen out of nowhere. They tend to come on without any real explanation. There's no real trigger necessarily. It just sort of happens out of the blue. The second one kind of demonstrates some of the symptoms that people might have during a panic attack. You may feel like your heart is racing. You may feel short of breath. You may even have a sensation like, man, I am going crazy. I don't understand this at all. The third one also exhibits another important point, which is that these things happen, again, spontaneously. And people who have panic disorder in specific, not just who have had a panic attack, because you have to distinguish those two things, but people who have panic disorder feel very, very anxious about these attacks happening again. So they may avoid certain situations. And we'll dive into that in the next couple slides. I'll explain what I mean more. So what is panic disorder? So people with panic disorder have this sudden onset of fear or anxiety that occurs repeatedly without warning. So again, sudden onset of fear, anxiety, occurs repeatedly, and there's no warning. The people, of course, can't predict when these attacks are going to happen, and during the attacks, they experience intense fear and anxiety. And not only that, they experience the intense fear and anxiety about having future attacks. So that's a really important point. During the attack, the person may experience increased heart rate. They may experience shortness of breath. They may begin to sweat. They may become dizzy. They may feel weakness. They may feel numbness or flushing in their skin or tingling sensation in their hands and extremities. They may have an underlying sense of impending doom, like, oh my God, my life is going to end in this moment. These symptoms also mimic medical conditions, because if you just look at some of those symptoms described here, you could probably think of a couple of common things, like such as heart attack or stroke, that somebody might think they're having. So this also shows you why a person who's suffering from a panic attack or panic disorder may come to the emergency room thinking they're having some kind of heart or cardiac condition or some type of neurological condition. Most attacks last a couple of minutes, but they can last up to like 10 minutes or so. I even sometimes push it to 15 minutes when I'm talking with people. But one of the questions you definitely want to ask is, how long does it last for? Because people will come in and say, yeah, I have panic attacks. And you go, oh, really? Tell me more about those panic attacks. And, they'll describe some of the symptoms, maybe, give you some details. But then they'll go on to say, and I'll say, how long do they last? And that person will then go on to say, well, it's like 2 hours or 3 hours I feel this way. Now, that's not really a panic attack. So timing is kind of important here as well. So panic disorder often is accompanied by other conditions. So some of those things might be depression, alcohol use disorder, and what I was getting at in the first slide is that it could even lead to phobias for certain situations. So if the attacks happen in a specific place, you may find yourself avoiding that place. If they happen, with a certain set of conditions, like, every time I take my kid to the mall, I have a panic attack. Then, you may start avoiding the mall, you may start avoiding taking your child out, etc. So they can lead to phobias. That's something to watch out for. Some people's lives actually become extremely restricted, basically to the point where they can't even function in their daily activities because they can't go shopping. They could have a panic attack while shopping. They can't drive their car because, well, they've had attacks while driving their car. Or it could get to the point where some people can't even leave their own house. So it can be mild, it could be severe. Depends on the person, depends on the circumstances. So when a person's life actually becomes so restricted that basically they can't do anything, or they can't leave the house, it's called agoraphobia. So what agoraphobia basically is a fear of open spaces, and it's a fear of being in places where escape is not possible. So, you're at a business meeting and everybody, including your boss, is sitting around the table, and suddenly you have one of these attacks. Now, not only are you fearful about the symptoms you're having, but you're also worried, oh my God, I can't leave this situation because my boss is going to see me walk out. So again, it can lead to more severe circumstances as well. So, whole point is that treatment is important and early treatment is better. So the quicker you get treatment for this, the less likely it is to progress to things like agoraphobia. Um, we already touched on a lot of these symptoms. I'm just going to reiterate a few of them. And actually, if you're a clinician and you're trying to remember all these, it is quite difficult to remember all of the criteria and to remember all of the symptoms. So it's best that you kind of chunk them into organ systems. For instance, some of the symptoms are related to, say, increased heart rate, so pounding heart, chest pain, sweating, lightheadedness, dizziness. So I kind of chunk that into more of like the cardiac section. You think about it as more of like almost like somebody is having a heart attack. The nausea could probably be thrown in there as well. Stomach issues like cramps, flushing, or chills. Then you have like sort of the respiratory symptoms, which I would say are the shortness of breath, the choking sensation. You can have numbness and tingling in the extremities. You can have shaking and trembling. And then you have the anxiety symptoms, which is like the feelings of unreality or dissociation, the fear of going crazy, the fear of dying. People will actually describe it that way. So it's important to kind of be asked those questions to the patient, and also to get a sense of the severity of these attacks. So, what kind of people get panic attacks? The bottom line is panic attacks can affect anybody. And panic disorder affects at least 1.6% of the population and is twice as common in women as men. So, a lot of what you'll notice in psychiatry or psychology is that women are often affected by anxiety disorders or depressive disorders a lot more than men. So, again, this also holds true with panic disorder. It can appear at any age, but generally starts in early adulthood. Not everyone who has panic attacks develops panic disorder. So that was the point I was making too earlier in the slides, which is that, you could have a panic attack and never develop panic disorder. So, a lot of people, I'm sure if you ask your friends or your family, you'll find at least one person that you know personally who's experienced a panic attack, but you may not know anyone that actually has developed panic disorder. Again, early treatment is key. So, what do we do to treat patients with panic disorder? Basically, most of the research indicates that you could do a form of psychotherapy, which is called cognitive behavioral therapy, and you can use medications or a combination of both. And what we find is that approximately 70 to 90% of people with panic disorder actually get better with treatment. So the improvements expected within 6 to 8 weeks. Again, even something like CBT takes time. Generally, it's a set number of sessions, but 6 to 8 weeks is probably a fair assessment. You're not going to necessarily have relief overnight, and it will take some work. So what does CBT do for the patient? It actually teaches the patient to view these panic attacks differently. So to take those sort of distorted cognitions and change them. And they also will provide the patient with techniques to reduce anxiety. So, and things to reduce anxiety, a classic one that they teach is breathing exercises, such as deep breathing that can help, lower heart rate and calm the person down. Exposure therapy is also a technique used in CBT, which will help people to alleviate any phobias that they may develop as a result of panic disorder. So basically with exposure therapy, we're trying to break the pattern of escape that maintains the fear. So what happens with patients who develop phobias is that they have such an intense fear of whatever it is that we're talking about, whatever the phobia is, let's say, I don't know, dogs, that we have to break the pattern that allows them to run away from a dog. Because if they keep running, they're always going to be afraid. So how do we do that? Well, a lot of times what we're going to do is we're going to start very slowly and methodically. You may start with the patient in the office and you may tell them to close their eyes and visualize a dog and think about, put that, make a very vivid image and, kind of feel the feelings you might feel if you were face to face with the dog, etc. So that's one way. Another thing you want to progress to then maybe after that is showing someone maybe pictures or videos of dogs. Then you might take the person out eventually into the park and find someone with a dog and have the person, maybe just stand by the dog initially, and then maybe it progresses to the point where they can pet the dog. And again, as you can see, gradually we're desensitizing the person to the feared stimulus. There are FDA-approved medications for panic disorder as well. The most commonly used ones are the SSRIs, and those include paroxetine or Paxil, sertraline, also known as Zoloft, fluoxetine, also known as Prozac, and of course Effexor, which is venlafaxine. Now, we do add benzodiazepines in there, such as Xanax and Klonopin are also indicated, FDA approved for panic disorder. However, those medications are not long-term medications. The key point to anybody, and I stress this a lot to like family practitioners who are prescribing some of these medications, these medications are not designed to be used long-term. They're bridges to get the person on a better long-term option, such as the SSRIs, and to deal with an acute panic attack in the moment. So somebody presents to the ED with a panic attack, I might use a benzodiazepine to calm them down depending on how bad they are. But I'm not going to give them benzodiazepines for the next 30 years of their life to deal with their panic disorder. I may do a few weeks of benzos in order to allow time for the SSRIs to begin working, because in other videos I discussed how these medications take, 3 to 6 weeks, 4 to 6 weeks to really see full effect. And we said up here at the top of the slide that improvement isn't really expected for 6 to 8 weeks. So again, you may bridge somebody with a medication like a benzodiazepine, but you would never use it long term, or at least you really shouldn't.